just out of breath all of the time now. That's all right. Well, I have some big life updates for you. It's been a while. It's been a while since I've really talked about anything, but two big updates. The first being I just started anesthesia, so I'm now in my PGY2 year, and let me just say, it has been so much better. What a breath of fresh air. The other big news is that I'm pregnant, and that's been a whole journey in and of itself, let alone doing it in residency. So I kind of wanted to talk about both of these things today. I don't really know which one I should start with. I mean, they're both such big things. But since I mentioned residency first, let's talk about residency, and then we can move into the pregnancy part of the video later. Basically, with anesthesia, if you don't know, you do your first year in either medicine, like internal medicine, or surgery, or a combination. I did a transitional year. That's what you do the first year. And then your second year, your PGY2 year, you start anesthesia. And that's when you become a CA1, or clinical anesthesia year one. And that's where I am now. Basically, the first sort of part of this, I just finished my third week. So we had 3 weeks of boot camp. And what this consisted of was having your cases during the day. And then at about 3 p.m., you'd go to lecture every day and then go home. And then once you get home, the list gets sent out for what OR you'll be in the next day and what cases you'll be having. And so you start pre-opping for those cases, and then you staff with your attending the night before. It definitely has been a huge adjustment, but in the best of ways, because I knew I wanted to do anesthesia for a long time now, and I knew sort of what it would be like. And it's just been a really amazing experience to go about my day doing what I've wanted to do all of this time. And I think in so many ways, like, it drains me a lot less than, say, medicine or surgery, because I don't want to do medicine or surgery with my life. So anesthesia at least has been a breath of fresh air. It's definitely been a huge adjustment staffing with the attendings at night. So oftentimes our list comes out I'd say late afternoon to early evening. And at that point, that's when I have to start pre-opping and then staff with the attendings after that. And usually I try to finish that before 7 p.m., but sometimes it goes later. So you have to call the attending, and their availability might not be exactly when you want it to be. Sometimes you don't end up talking to them until like 8 p.m. or after, and that can just make for a very, very long day. So that has definitely been a huge adjustment for me. And then the early mornings, which I'm a morning person, but it's pretty early. Like, I need to get there by 5:45-ish most days, maybe a little bit earlier, maybe a little bit later, depending on the caseload for the day. But there's some early mornings. Yeah. But it's awesome. It's really cool. I find that I vibe a lot with the anesthesia folks, and I love being able to be that presence with the patient before they go back and do something scary. Like, it's really scary undergoing surgery, and I love that I get to reassure them and help them through that phase just before surgery and just, counsel them along the way. I'm still sort of getting in my groove with studying. My program has been very adamant on reading a textbook and less focused on practice questions. Historically, I've been a very huge practice question proponent, and I think that the brunt of my success on board exams in the past has come from loads of practice questions. I find that doing something like actively learning really helps me retain information better, but my program is very big on reading, so I'm just following blindly for a little bit here, and I'm reading, and then I'll get back into practice questions. I actually already bought the TrueLearn question bank for anesthesia out of my own pocket a while ago, and I've, made a dent in it. But I'll get back into that soon. But I'm just trying to read more and kind of develop a depth of understanding of things first now, since that seems to be heavily emphasized, and then I'll sort of weave back in the practice questions. I've still been doing a few here or there. I'm focusing mostly on reading as it pertains to my patients. So one of the days I had a patient with a BMI of 55. And so I spent, some of my time reading all of the information there was in the Baby Miller book, which is the basics of anesthesia. reading about obesity and, how that impacts propofol dosing for induction and maintenance. And yeah, I've been trying to do that. And I had a patient who had a history of intraoperative awareness, which is when people are awake or like have awakened during surgery. And so I spent a lot of time learning about that, which was really interesting to me. I didn't realize that it could impact people for quite as long as it does. I mean, it can lead to PTSD for people. And it's more common in certain surgeries like trauma and OBGYN and those sorts of scenarios, which I can imagine would be very stressful for people to be awake during, especially trauma or like cardiac surgery stuff. So that's been really interesting. But yeah, that's what I've been trying to learn about, is like reading about the conditions that my patients have. Like, how do we handle a pacemaker in surgery and those sorts of things. So yeah, but so far the learning curve has just been very steep, but I'm hanging in there and I'm starting to get better with the basic setup, coming in the morning, doing the machine check, getting all of my meds, all of that. There's that MS MAIDS mnemonic that I could go over at some point if anyone's curious. But yeah, I'm finding I'm starting to get better with that. And then once the surgery starts and I intubate and, making sure to, if it is appropriate for the patient, giving, dexamethasone and antibiotics and, getting into the rhythm of things. Yeah, it's starting to go better. I'm getting into more of a groove with intubating. I'm definitely starting to see a lot of progress with my IVs. I think I'm, so far, knock on wood, I've been getting the majority of my IVs. I did blow a couple on Friday, which was disappointing, but the person was 94 years old and had difficult veins and very fragile skin. But yeah, and I felt really bad for poking them. But when I called in the reinforcements to help me with this IV, they didn't get it on their first try either, which was reassuring in a way that I wasn't struggling for nothing, but this was pretty difficult. So anyway, I have noticed a lot of improvement, and yeah, I'm just so happy. Like the day in and day out of anesthesia is so much less draining than internal medicine and surgery. Like notes and everything, our notes are pretty simple with anesthesia, at least where I'm at, and like orders, and I have gotten very few pages just in the general OR versus on surgery and medicine. I really had a hard time managing getting paged hundreds of times in a day. Yeah, it just turns into such a message notification heavy job, and I'm really happy to be able to focus on one patient at a time right now. It's been so much of a better fit for me personally. So yeah, anesthesia has been good. Like I've really enjoyed it. Yeah, so I can talk about more of that, I think, as I go on. And I guess the other thing that I wanted to talk about was pregnancy in residency. So I think as a woman, I think a lot of women can relate to this who are in medicine. You have your friends who are also female or whatever, and you talk about this, right? Like, when is the best time to have a kid? When do you think you'll do it, if you do it? And it becomes such a strategy over the years, and it's on the forefront of people's mind, as we're in our late 20s, early 30s in this process, like when do you start that family, And I think I'm very fortunate to have had a supportive husband throughout the duration of my medical journey so far, so that basically at any moment when it feels right, that's the time to do it. My situation is definitely nuanced because I, for the majority of my life, haven't really desired having a child, like going through the whole process. I've always leaned more towards adopting or fostering. But it was a conversation that I had with my husband, and we decided that this is the right path for us right now. So yeah, we made the decision that, let's do this. It happened right away, which I sort of wish it wouldn't have. I was anticipating it would take a lot longer than it would have, but I think the timing of it has turned out quite good, actually. It was very challenging to be in my first trimester at the end of intern year because I had a very inpatient heavy end to my intern year. It was really challenging. It was really challenging, and I was so exhausted, nauseous all of the time, throwing up a bit. I know so many people who have had it so much worse than me, so I don't even want to like really touch on that. But it was pretty miserable, like very miserable. Like food aversions. I mean, I think I pretty much just ate like pasta and like pizza for a month or a couple months straight. It's like those aren't even my favorite foods, but that's the only thing I could tolerate. So yeah, and navigating that time, feeling so crappy and working so much, it really took it out of me to the point, when I have one day off per week, all I did was sleep and just lay there. And, I would go to work and then I'd come home and lay and then go to bed and then repeat every day. It was not fun. It was not fun. But, after a little ways of getting into my second trimester, I started feeling better. And that has made the experience better so far. Because it was kind of falling towards the end of my intern year that I became pregnant. I decided to tell my program director for anesthesia and not my, TY year program director. I just thought, maybe it won't impact them as much, but it will impact scheduling exponentially once I get into anesthesia. So I let them know, and the response was the most kind-hearted response. I felt so supported, and it makes me very grateful that I chose the program that I did, and that, I'm so fortunate that they also wanted me, because I could tell, even as a medical student doing a rotation at this program, that this is a place where I think I could, if I decided to have a family, this would be a place that I feel like I would be supported. And across the board, on all of my rotations so far that I've been pregnant, everyone has been so understanding. I mean, there was a day that was kind of slow on internal medicine, and I just put my head on the desk because I was feeling so exhausted, and the attending was like, "Do you want to just go lay down for a little bit? Like, feel free. Like, we've got everything teed up for now. Just, go lay down." And so, just to have people who consider you is really nice. And then, making accommodations for me in the OR, like, there's this cement that's used in ortho cases. I think it's called polymethyl methacrylate. Anyway, you shouldn't be around that. It can cause birth defects. So people have, looked out for me and made sure I haven't been in those cases and those sorts of things. But yeah, my program has been extremely accommodating left and right. My co-residents have, volunteered to take my call. I was supposed to be on call over Christmas, and I've traded ICU months, and I feel very fortunate to have a program that has supported me as much as they have. If you're out there and you're thinking about getting pregnant in residency, I really encourage you to really suss that out when you're going through the interview process, or when you're, doing your rotation at this program. It doesn't have to be a direct question to them, but you can tell. Like, you can tell when a program would support you and when they wouldn't. Like, you can tell a malignant program from a not malignant program. And I think that has been a huge factor in feeling safe to go through this, right? Rather than not. So anyway, the experience of being pregnant in residency has not been easy, but my program has made it as easy as they possibly can on me. So like this upcoming week, I have my anatomy scan tomorrow, and then like later on in the week, I have an OB appointment that's going to go over the anatomy scan if there are any issues and whatnot. And, my chief residents have made it such that I'm on a service that day that can accommodate me going to this appointment. It gets a little bit hairy in anesthesia because you're assigned to an OR, and there aren't always people who can come and relieve you for the amount of time that you need to go during the day, because of, staffing and whatnot. So I'm going to be on APS tomorrow, which is the pain service, rather than being in an OR. And that means that I will be able to go to my appointments. So I really think that my program has done like a phenomenal job in allowing me to do this. I'll deliver later on in the year, and from the looks of it, I'll get 8 weeks of maternity leave, which, I think is pretty good, all things considered. Of course, I would love for more. I think that would be great, but I think I'm okay with 8 weeks. From what I hear, you could take up to 12. I don't know that I really want to be I don't want to be home for 8 weeks. I don't know that I would like that. I might lose my mind. So that's what it sounds like. I have to do a little bit more digging in all of the maternity leave stuff, and I can definitely talk about that more in a different video after I've navigated the whole situation. But as it stands for now, I have 8 weeks that have been blocked off for me for maternity leave. So yeah, yeah, that's been it so far. It's been a wild experience, and yeah, I just have to say I'm glad to be in anesthesia now. I think that everything feels better now. I did not like I didn't like intern year very much. It feels like I'm finally doing what I've wanted to do this entire time, and that just feels so freeing. Yeah, it's still a lot of work. It's still a lot of hours, and I'm very tired. I'm so much more tired than I think I would be if I weren't pregnant, but so much better. It's so much better. So, if you're out there and you're going into anesthesia, there is a light at the end of the tunnel, at least now. I mean, I think things could get a lot more dark for me moving forward. I think our CA 2 year is the hardest year because you're going off site to different locations, and you're doing those subspecialties like peds anesthesia and trauma ICU and OB and that kind of stuff. So it gets pretty. I think it gets more dark, but yeah, so far it's been great. That's all I got for now. We'll see you in the next video.